Can I come in?
Yes, ma'am, you may.
Hello. How you doing?
I'm doing okay.
Miss Nadine, I'm Maria. We talked earlier. I just want to go over some of, I know you just got diagnosed with COPD. You might have a lot of questions. Is that correct?
Yes, I have some questions,
Okay.
but
So-
I'll just let you explain. I'll just let you do the talking.
Okay, so this is a book that I'm gonna provide to you to go home. We're just gonna go over
Okay.
you wanna get your phone or we?
Yeah, sorry.
Okay, no problem. So we're just gonna go over the most important part, and just go over. If you have any question, please allow me to know, and we could go over. You might wanna ask, what is COPD? Like, we in the medical field, we love our mnemonic. It's just simple, means chronic pulmonary disease.
Okay.
So with that saying, it just makes it hard to breathe.
Yes.
Like you were feeling.
Yes.
Yes. So COPD is divided into like two, emphysema or chronic bronchitis. Most of the cause it's either because of being a smoker or also because of extra natural things on the air, like if you were a mining, if you pollution, if you've been around people that secondhand smoke.
Yeah,
Yes.
that's what that was. Secondhand smoke.
Yes. Some of the risk factors that we have, the like disease that make you most likely to get COPD is diabetes, if you are overweight, heart failure, or GERD, which is your stomach problem. There's like 4 stages to COPD. The first stage we call it mild because it's very easy to misdiagnose, or even for the patient itself to come in once in a blue, they feel short of breath, or they're not seeing, they think it's normal, days and days. Stage 2, like you get like short of breath while you exercising, but you're like, okay, because I'm exercising, I'm not gonna think about
out of shape. Whatever.
Yeah.
Yeah.
So with the stage 3, it just becomes more often. Like, okay, I'm going up the stairs, I have to stop. And then on stage 4, it's just like, it's more frequent, it's happening while I'm not even exercising, like I need to do something.
Yes.
So I just have pictures here, just show you, remember how I told you about how it, this just shows you the alveoli, those little sacs in your lungs that open up and expand and allow air to go in and go out, because we want those air to go out, because inside we have the dead air, which we call carbon dioxide, and we getting in oxygen, so that those exchange needs to be. So as you see here, those sacs, those healthy sacs, they're like a little ball, they open and close, they have the ability to expand and close. Over here you see your lumen, how they open, they're pretty, those like just your muscles,
healthy.
yes. So instead a lung that has COPD, their mucus, like you have all this extra flinch that you were saying, and you see how those sacs are like not expanded and not open, making it hard.
Tighter breath.
Yes. So like we talk about it, of the cause, we talk about smoking most of the time, the air pollen, or also like people have genes, like because like
from genetic.
Yes, like a family member has it, and then most likely, yes.
Oh, okay.
We also some of the symptoms that people tend to have in the beginning are like that constant cough, where they call it the smoker cough, that dry cough. Yeah, and short activity, like when you're doing any exercise, sometimes you feel like you have to catch up with your breath or short of breath. You have that wheezing,
like asthmatic wheeze, tight.
Yes, and then you have that like all that fling. All of a sudden you have all this fling, and you're not sick, and you wonder what's going on. As the time goes, as it becomes worse or severe, as we call it, you having more short of breath, and you having like when you lay in flat, you feel like you're choking, and you're more tired, you most likely will lose weight because if you cannot breathe, you're not eating. So you're afraid of, let me close my mouth to eat because I will feel short. Yes. And then when a lot of people, they tend to turn blue, but in our color it look purple, and your lips, you also look around your fingers, we call it the clubbing fingers, like they not getting oxygen, they get big, like big, yes. So it's like for us dark people, you just see it on the nail, you see purple, yes, purple, bluish. So some of the tests that we do, like we did with you, the spirometer, we allow you to breathe into it, like, and then breathe off. The bronchoscopy that we go into your nose, we just check in your lungs, and we also do some imaging, which is could be X-ray, CT scan. Or also remember how I said we can also check if you have any genetic factor.
Yes.
Those are the alpha one that we do. Also we do ulterior blood gas. So the respiratory therapist just comes in and takes some blood in your gas. We just check the health of your
blood cells.
Yes, to check all your gas. Like we check your whether it's acidotic or not, whether you having too much oxygen or too much carbon dioxide.
Okay.
Yes. You might wonder, how can I manage my COPD? So one of the ways, medication-wise, how you can manage, we have bronchodilators, because remember about those sacs that I said they get really tight and they cannot open up. So what the bronchodilator does is, those are the medication that will be able to dilate, open them up. So while they're short end, so they help fast, and they're like, usually when you have those acute one, it's happened right now, so you take that. Some of the side effects that you should expect is, like, you could have headache, dry mouth, so I will recommend drinking a lot of water. Yes, you might have constipation, so walk. You might feel palpitation because when they dilate, so it goes faster, your heart is going fast. You might feel nervous or nausea. Those are some of the side effects. Corticosteroid, which is, we usually call them, which is steroid. So one of the things that they do is, because corticosteroid is when it's inflamed. You remember I told you that they get inflammation. So they take those down. So one of the things about corticosteroid, if you are diabetic, you gotta be careful because it will give you a higher blood sugar dose. Yes. Yes, and some of the side effects that you see on corticosteroid is increase your LA, like makes you want to eat more, and increase your risk for infection, and it makes your skin thin, and also oral thrush. So that's why we recommend that after you use the inhaler, please wash your mouth before. Yes, we also have antibiotic to treat that bacteria, because we don't want the bacteria there. We have antihistamine. Those are usually to treat, like, if you have you're allergic to anything, if it's caused by allergies. So some of the side effects you could see when you're taking those medications. You feel drowsy. We don't recommend if it's the beginning to drive, to see how much it affects you. Also, you feel dry mouth, blurry vision, you have urinary retention. So those are all things that you wanna, like. And then if you taking this meds and you feel like short of breath, please call us 911 or call your other providers. Also, if you are taking any herbal, because we went over your medication, I did not see any herbal medication. If you are, before you take any herbal medication, the issue with them is because they're not FDA regulated. Yes, so
you might mess with the medication.
Yes, please let us know. Call me at the number I gave to you. Yes. Also, we have oxygen therapy that we do. Is like while you're walking, we have remember about the That's that oxygen machine that I told you that we could put it in our fingers,
Yeah.
and we bought it for you.
Yes.
We could put it on your finger. It just allows you to know like your oxygen level.
Okay.
Okay. Do you have any question for the things we went over so far?
No, you've been very clear.
Okay.
Yes. Yes.
Yes.
Very good.
So we also could go like, so let's say worst case scenario, we have surgical intervention that we could do. We could reduce your lung, like they go in.
That's at the stage where it's
Like-
like really, really serious
Mhm.
at this point.
Yes.
Yes.
So they remove the damaged part of it. They go in, they cut it in, and then allowing the good tissue to just grow without being
Oh, okay.
trapped. We also have lung transportation. Transportation. If somebody, yes, if somebody wants to give you a lung, we will be
Yes.
able to put you on. We also have a bullocktomy. That is the procedure where they remove air pocket and put it, making it easy to breathe. Because when those pocket becomes inflamed and full of mucus, we be able to go in and take it off.
Oh, so question.
Mhm.
You said that in some cases a transplant
Yes.
is one option, but what if just a part of your lung is okay? At what stage do they offer a transplant? Is it when there is nothing else that they can do for the lung? Is that?
Yes, so those are like the surgical intervention. We have cases where people do live with one lung,
Okay.
but the lung that we give, a lot of tests is done. That's
Mhm.
when we get to that period, a lot of tests is done, making sure that
Right.
you're able to, that you guys are compatible,
Okay.
everything, and then you were given a healthy lung from a donor. So you might wanna, you might question like, how can I like put a pause to those symptoms from happen? So I say, eat a health diet.
Mhm.
Make sure you manage your weight, because you don't want to put all like having extra diets, putting all that
Yeah.
force in your lungs.
Yeah.
Making sure you
Breathe
taking
harder.
your medication.
Mhm.
Make sure you clean in your equipment. Like we're giving you the
The
BiPAP and the
breathing,
yes.
yeah.
Make sure like there's no, and also when you put in the oxygen, one of the things that we want to let you know, please have no one smoking next to when the
Of course,
oxygen is
makes sense,
on.
yes.
Making sure that the plug is always on. Make
Mhm.
sure also it's not under the carpet, like at places that people
Yeah.
could see.
Yeah.
You wanna also maintain a health lifestyle,
Yes.
like aerobic exercise, like by swimming,
To help.
walking. As you
Mhm.
walk, you the thing is, if you feel short of breath, please stop.
Mhm.
And it's good to have that the oxygen
on
yes,
the finger.
on
yeah.
your finger, so it allows you to know. So
Mhm.
with COPD, we usually a healthy one, nothing under 88, between 88 to 92. Yes, but you wanna be above 95. But
Mhm.
as it 88, nothing under 88. So you just sit down, take deep breath. We could learn how to do deep breathing. So where you go, smell, like I like to say, smell the coffee and blow the candle. So you do pursed lips. It's like
Mhm.
you want to try like you're throwing a kiss. And very slow. Yes.
Mhm.
So you're getting in those healthy
Inhale and
oxygen, and then
exhale.
making sure, and don't forget to take it out, like almost like you're blowing a kiss.
Oh, okay.
Yes, good job. Like emptying out, very slow. Yes. Yes. So like you're getting in those health, but we also not forgetting to take it out. So it's very important to follow up with your. We have a whole team. You have your respiratory therapist.
Yes.
That is one of the important team members. You have your primary care that you go in. You also have the social worker that can get you the
Yes.
equipment that you
Yes.
need, the spirometer if
Yes.
you need anything. You also have us, the home, the nurses, And also in your case, you have those nurse aide that comes to your house.
Yes.
And if you need help with like quitting smoke, we have help. We do recommend stopping smoke. We do have patch that you could start with patch.
Yes.
We also, the social worker could give you, they have groups of people that like, they help each other. They
Like a
get
therapy.
Yeah, like a therapy, yes. It tends to be like some of our patients that went there, they really love the group.
Yeah.
Yes. Do you have any question?
No questions so far.
Yes.
I mean, you've basically explained, you've been really thorough in your explanation, and I really appreciate, how you explain everything, so that way the information came out clear, was given to me. I understand everything that you're telling me, so yes.
So the other thing I wanted to talk to you is advanced directive. So with advanced directive is, I think at times we think we don't prepare for everything, and you want your wish to be clear.
Yes.
So
if worst case scenario.
Yes.
Yeah.
So where your family members or anybody else is making those wishes that you will make at your time. So we have, I have advanced directive here that you could do, and it's either advancst directive could be a living will where you put in what would you want it to be
My
done,
wishes.
your
Yes.
wish, or you could have a durable power of attorney where you could appoint somebody.
Yes.
It doesn't have to be a family member, somebody that you trust, that you guys have had that conversation
Yes.
to talk about it. We have a lot of community work that could help you, that could assess you. I know you said one of the things that we talk about, I know you said your granddaughter has been teaching you going online.
Yes.
Yes. So there's like a
resources.
Yes.
You have to look stuff up
Yes.
and research.
Yes. So we have American Lung Association. You could go on lung.org,
Yes.
and it has amazing information, very geared to each population, which I like a lot. We
People
also
share their stories.
Yeah.
Yes.
You can learn so much. We also have COPD Foundation, which is copdfoundation.org. You could call us at any time.
Yes.
You also could call the hotline
Yes.
over here. And this one is just a plan that I wanted you to have.
Okay.
You fill it out. You tell me when you walk in, and then it tells me like it just goes over like zones. Like the green zone, you're doing good. The yellow zone, you're getting iffy. The red zone is
You need to
good.
take care of
Yeah.
it. You need to
So
get it
you
done.
could use this every day
As a
as a
guide?
reminder.
Yeah.
Yes. And then this one is just you go over. You tell me while you're walking, like how is your oxygen
feeling and
Yes.
stuff. Like just make a note.
So
keep
yes, like a
check.
diary. So the
Yeah,
next time,
yeah.
then 2 weeks from now, when we come back, we'll be able to go over.
Yes.
Do you have any question for me?
No. Are you gonna be leaving this booklet with me?
Yes,
So I
this
can
book
get it?
is yours.
Okay.
And I also have my card here. You
Mhm.
call me anytime.
Thank
And
you.
also, if you go home and you have any question, please give me a call.
Absolutely, will do.
Okay, nice meeting you.
Nice meeting you. Thank you so much.
No problem.
Okay.